Hi, good morning, guys. So I get many DM on my Instagram page asking whether to choose between NEET PG or USMLE, that is doing residency training in India versus in United States. So I was a dermatologist back in India, so I have experienced residency training in both the countries. So I can very nicely pick up the difference between the two training. So yeah, in India, what I had experienced was that on day one, my seniors would just give away everything for me to do. There was no such training time like 1 to 2 months where your seniors they gradually pass on the work to you. Versus in United States, we had an orientation training of about 7 to 10 days where they taught us the software, the electronic medical record system, the rules, regulation, how does the work go, when can we take leaves, and per cap patient load. More than that, a resident cannot work, like the limit is around 10 patients per resident. Whereas there was no such clear-cut limit in India. We were expected to do everything, whether it was outpatient, inpatient, and number of patients. Teaching is way different over here. Compulsorily, we have to attend around 15 to 16 hours of lectures in a week, which is far lot more than what we did back in India. And one most important thing which I appreciate about US is that there is no difference in the positions, like whether you are a senior resident, whether you are a junior resident, you are treated equally. Everyone talks to you very nicely, be it the attending, be it the nursing staff or any other hospital staff. Whereas in India, being a first year resident, they'll like look at you as if you don't know anything, and it was very difficult coordinating with other staff in India. But here, everyone is so nice, you don't find it difficult to work or coordinate with other people. You don't have any fear of communicating or asking any random thing to your attending physician. You can actually cross-check his orders. You can give your suggestions without any fear as to hurting his ego or not. Whereas in India, I had to think twice or thrice before putting on my suggestions. The most important thing is leave. In United States, there is a predefined rules of how a residency should work. They call it ACGME guidelines. According to that, a resident should not work continuously more than specific hours, and we should get at least 1.5 day leave every week, be it any residency. Whereas in India, there was no such clear-cut definitions of work or leave. Even though you are having a leave officially, you especially have to go and ask your chief. So I remember when one of my colleague over here, she wanted to go out and she asked me to do her duty instead. So I agreed, but the chief resident, she personally talked to me that, are you sure you want to do work extra for your friend, and are you sure that she'll exchange your duty as well, because we don't want you to overwork, we want you to take a break. So I felt really very much taken care of. Different from India, you get a very nice compensation packages over here, including your salary, and apart from your salary, they also take care of your taxation, of your medical insurance, and other aspects like retirement saving and everything. They give you meal allowance, which in India, everything after you get your salary, you are supposed to take care of your money. And we also get compensation for our books, for any educational resources. We get around $1,500 a year for a conference. Whereas in India, I myself used to empty my pockets if I wanted to attend any conference. Now coming to the healthcare system, it's totally different. Here, everything works on a software, which we call it electronic medical record system, and it's very user-friendly. Different from India, I just have to give my orders. Whether it is any medications or whether it's any procedure, it will be automatically done without any doubt by the nursing staff. So it becomes easy. Versus in India, I myself had to go and check if I got the reports of any patient, if the patient got his medications, whether he's taking properly or not. Apart from that, when a patient gets discharged, Where will he go is very, very important. In United States, we call it disposition. So the nursing staff, social worker, home health worker, they all make sure that if the patient is alone, he does not have any caretaker at home, he goes to a nursing home, and they regularly go and check out with his lab works, medicines, and how well is he doing after discharge. And yeah, paid vacations are very, very important in residency. So according to ACGME guidelines, you are supposed to get few weeks of paid vacations every year. For us, I think it's 3.5 weeks. It differs according to the program. Whereas in Indian residency training, there was no such paid vacation. You literally had to beg for your leaves, and they would give you leaves only if other residents are comfortable and only if they are there to work for you. The most heart-touching gesture was that when I arrived in United States, I didn't own any car. I had to either book a Lyft or Uber to go to my hospital for like 1 to 2 months before I own a car. So the hospital made sure that other senior residents will come to pick us up and drop us till we get a car. So it was very, very sweet of them. I would never ever expect such gestures from Indian hospital. One another different aspect is in Indian residency, you get to work in just one hospital, but here in United States, every hospital allows you to take I think few months of elective rotations in other hospital. If you wish to learn something different, or say you are interested in cardiology, then you can specially take a rotation outside your hospital to any advanced cardiology hospital. And here in internal medicine, we get to rotate in all the subspecialties every month. Nothing is unexposed. Versus in India, my medicine residents, they just did core medicine, internal medicine, and if the hospital didn't have super specialty in their setup, they were not exposed to other subspecialties. They had to learn it after they take admission into DM. And yeah, coming to DM, one good news is in United States there is no entrance test for getting admission into your super specialty. You just have to make your profile by doing research, making connections with different attendings of that super specialty. They write a letter of recommendation. You go through the entire process of match, you do interviews, and then you're selected. Another thing which I admire about the US healthcare system, be it a resident or an attending physician or a super specialty, there is a fixed hours of work. Like you, for example, if you work from 6 to 4, you work from 6 to 4. After 4, you are not responsible to attend any page or calls regarding any patient. After coming home, you will not be disturbed. You will just enjoy your evening time. Different from India, here there is a special wellness program for residents in which the hospital takes care that you are not burnt out, you are not exhausted. They take a group of doctors for an outing or any extra co-curricular activity. So coming to pros of Indian healthcare system, definitely you get a lot of patient exposure. So by the end of 3 years, I mean, you are almost trained to handle any kind of cases. And believe me, the amount of exposure you get in Indian residency training, you don't get it even after you start your own private practice or you join as an attending to any other hospital. So yeah, India being the second populated country, you get variety of cases, any rare presentation of a common case as well. And last but not the least, in US healthcare system, if you get trained, you are not supposed to complete your final PG exams at the end of 3 years. You get a time limit of 7 years from the start of your residency. Within 7 years, you can complete your final exit exam. And that doesn't stop you from getting any jobs. You can start applying for your job from your third year residency as well, irrespective of your exit exam scores. By the end of third year, people usually apply also for their super specialty exams or job as a hospital. So it's a little bit different from India, where you have to pass your PG exams to get a degree and then only you're eligible for a job. Also, USMLE degree is valid in many countries all over the world, including few parts of Canada, New Zealand, and UAE countries. So hope my experience helps you to decide whether to choose for NEET or USMLE. Thank you. If you have any questions, please don't hesitate to connect with me either on my Instagram channel or down in the comments. Bye-bye.